Hi, Amanda.
Hi.
Dr. Tarola.
Nice to meet you.
What brings you in today?
I've been having some lower back pain. It started a couple days ago when I went to go lift up my son. He weighs about 30 pounds now. I was bending over, and when I went to go stand up, I started with this excruciating pain.
Are you having any pain at all that spreads into the legs? Any feeling of numbness or weakness in the legs at all?
No.
And are there any particular positions or activities or movements that tend to make it worse?
Sitting or standing for both long periods of time really seem to aggravate it. Once I start to get up though and start moving, it gets better.
So it tends to be better with movement?
Yes. I'm just not sure if this is something serious or not.
I can tell you the vast majority of back problems like this are not considered serious. 85% of back pain similar to this is considered mechanical, meaning something mechanically strained, either some of the muscles, tendons, or joints in the lower back that causes this kind of problem. There's only about maybe 5% of back pain that would be in the serious category, things like infection that could cause back pain, or if cancer is an issue that can potentially cause back pain. If there's a real serious or severe underlying nerve problem, that would be considered serious, but we'll be able to assess that with a physical examination.
Okay.
All right, Amanda, based on your history and my physical examination findings, there's no indication at all that there's anything really serious here. Your condition appears to fall into a mechanical category, meaning something strained either the muscles or the tendons or the joints in your lower back, and they have to heal.
Do you think it's okay for me to continue lifting my son?
Since that was the cause of your back pain to start with, I would be real cautious how you lift your son, and I can instruct you how to do that so that you don't continuously aggravate your lower back. If it happened once, it could happen again.
Are you sure I can manage this on my own? I don't need an MRI or any kind of study?
Yes, imaging studies like x-rays or CT scans or MRIs are usually not recommended early on with a back pain episode like this. They're usually not really helpful in either arriving at a diagnosis or helpful with treatment recommendations. And one of the reasons for that is that because they tend to have a very high what's called false positive rate. That means that there are a lot of things that will show up in these imaging studies that really are not important for your back problem at this time, and oftentimes can lead to other unnecessary tests and sometimes even interventional procedures that carry significantly higher risks. So you can try and self-manage this on your own for a couple of weeks or so, and I can give you some recommendations as to how to do that. Your other options are to consider something non-pharmacological or non-drug related, which would be either chiropractic treatment or physical therapy, if you would choose either one of those routes. So it's really up to you, whatever your preference would be. What I would recommend is after a 2 to 3 week period, if you don't feel as it's improving at all or adequately enough, that you come back and let's reassess it to make a determination as to whether some other form of treatment might be most appropriate at that point, or whether some form of imaging or other testing procedure might be appropriate.
Okay, that sounds good.
Very nice to meet you, Amanda.
You too. Thank you.